Thanks for watching our talk today. For this study, we examined the effects of textual and visual forcefulness on responses to a public health announcement that conveyed protocols for wearing a mask to slow the spread of COVID-19. I'm Chelsea Radcliffe, and I'd like to acknowledge my co-authors, Andy King, Jacob Jensen, Helen Lilly, Manusheila Pokerel, and Dallin Adams. And funding for this study came from the Immunology, Inflammation, and Infectious Disease Initiative at University of Utah. Wearing a face covering in public and around others has been identified as an important behavior for limiting the spread of COVID-19. However, as we know well, universal compliance with mask mandates and recommendations has been difficult to achieve. One reason is that some people feel this limits their behavioral freedom, and potentially this perceived freedom threat may be enhanced or mitigated by features of public health messages promoting mask wearing. So early on in the pandemic, many government and business leaders were unsure about how best to encourage people to wear face coverings. Should they take a forceful stance, such as telling people they must wear masks, or should they make a courteous appeal, such as inviting people to consider wearing masks? On the one hand, a forceful appeal could be taken more seriously, but on the other, it could backfire if it's perceived as freedom-threatening and thus triggers psychological reactance. Psychological reactance theory and a vast body of empirical evidence suggests that people perceive forceful health recommendations as freedom-threatening, which in turn leads to reactance and lower intentions to comply with the recommendation. But while this backfire effect has been well examined in the health communication literature, it's been almost universally studied for the promotion of behaviors that benefit the individual message receiver. And potentially promoting an other-focused behavior, such as wearing a mask to protect others, invokes a spirit of goodwill and thus maybe softens the message receiver's reactance to a commanding appeal. So our first goal was to put this to the test by examining the impact of language forcefulness in the context of promoting mask wearing to protect others. And based on the bulk of existing literature, we hypothesized that a forceful appeal would produce lower intentions to wear a mask via reactance compared to a courteous appeal. And I'll note that while using masks in public has been mandatory for the past several months in parts of the US and globally, at the time of this study in early summer of 2020, it was still primarily a recommendation rather than a mandate. And now in May of 2021, many states in the US, as well as elsewhere in the world, have lifted their mandates, but still hope to encourage masks in public. So communicators are again in the position of deciding whether it makes sense to frame their appeal as courteous or commanding. And reactance studies in communication research have focused almost exclusively on freedom-threatening language features. But reactance reviews from Reynolds-Tylis and Rosenberg and Siegel recently highlighted the need for examining a broader range of message features that might provoke freedom threat, including attention to nonverbal communication features. And in fact, one recent study from Armstrong and colleagues did find that the presence of the color red in a public health announcement enhanced the link between strong language and perceived freedom threat. So there's some emerging evidence that audiences are sensitive to nonverbal cues when they're processing these types of public health messages. And the need to consider visual features in reactance studies is complemented by a call from King and Lazard for research to inform how visuals can be used strategically to convey information during a pandemic. So we chose to test whether a forceful stance in our image model would be received differently than a neutral one. And we depicted the model holding up their hand in a stop gesture because we had seen this in some public signage in our communities. And we suspected that the forceful image with the stop gesture would be perceived as more freedom threatening than the image of the person with their arm down by their side, and thus produce lower intentions via reactance. We also wanted to incorporate some of the natural variation in images used in real public health messages and to test whether this would differently influence outcomes. So we varied the sex and race of the model in the poster to be male or female and black or white. And we were limited in the number of variations we could include in this study. So we opted for comparing black and white models here, but we do intend to test this further with a broader range of races and ethnicities in the future. So for this study, we asked whether the sex or the race of the model depicted in the public health announcement would influence reactions to the messages. And lastly, given the observed links between political identity and message reactance, as well as responses to the COVID-19 pandemic, including preventive behaviors such as mask wearing, it made sense to examine political affiliation as a moderator of message effects. So we examined whether political affiliation would moderate the indirect effect of message features on mask intentions through reactance. And to engage these questions, we developed messages in the style of a public health poster conveying information about masks from the CDC. And we varied the forcefulness of the appeal in the header and footer of the message, as well as framing the action as either a duty in the forceful version or as a choice in the courteous version. And we also varied the forcefulness of the illustrated person in the image that's communicating the message. So we varied whether their hand was up in the stop gesture or down by their side. And the stop gesture was intended to emphasize that the person should stop and not go out in public without a mask. And lastly, we varied the sex of the model and the race of the model. The study was an online experiment conducted with 856 US adults that we recruited through Qualtrics panel services in June of 2020. And as noted on the previous slide, we had 4 fully crossed message factors, so 16 conditions total, and participants reported information about their demographics and then were randomly assigned to one of these 16 conditions to view the public health announcement, and then they answered questions about their reactions to the message. We measured reactance to the message using measures in line with the intertwined model. And in addition to examining perceived freedom threat, anger, and counter-arguing, we examined perceived visual aggressiveness of the message with a measure that we developed for this study. Then we measured their intentions to wear a mask in the future, and I'll just note that all of these scales had pretty high reliability, at least 0.89. And then we measured their political affiliation, asking whether they more closely identified with the Republican or the Democratic Party, and it was about a 50-50 split. Prior to testing reactance as a process, we examined the main effects of each message feature on each variable using a series of 4-way univariate ANOVAs. And as indicated here in the table, forceful language did produce more perceived freedom threat than courteous language. But the forceful hand gesture was not perceived as more freedom threatening than the courteous or neutral hand gesture. And let's see. The forceful hand gesture was perceived as more visually aggressive than the courteous gesture, but the difference wasn't statistically significant. Additionally, the messages featuring male models were perceived as more visually aggressive than those featuring female models, and participants reported more anger if they received a message featuring a Black model or a male model. They also reported more counter-arguing and lower intentions to wear a mask if the message had a male model. And I'll just mention that freedom threat was higher here for the messages featuring male models than female models, but the p-value was 0.085 or 0.058. So not quite significant, but we did find it worth exploring in the reactance models. And I'll just note that political affiliation did have some influence here. We didn't have time to go into those analyses here for this talk, but the impact of model race on anger only occurred among Republican participants, and the effects of model sex actually were present for both Republicans and Democrats, but they were generally stronger for Republicans. We used the process macro in SPSS to examine the reactance process, and as expected, forceful language had an indirect negative effect on participants' reported intentions to wear a mask via perceived freedom threat and reactance. And you can see that the effect is small, but it does not overlap 0. We also examined political affiliation as a moderator of reactance using a conditional mediation model. And as illustrated here, there wasn't an interaction between forceful language and political affiliation. Both forceful language and political affiliation each had an individual or independent effect on perceived freedom threat, and the path for the interaction term wasn't significant. However, you will note that the indirect effect was only significant for Republicans and not Democrats. So this overlaps 0 for Democrats. So this suggests that there was a stronger reactance process for Republicans than Democrats. And given the nearly significant effect of model sex on freedom threat, we also examined whether political affiliation might moderate this effect. Again, both male models and political affiliation each had an independent effect on perceived freedom threat, and the interaction was not significant, suggesting that people in both groups found the male models more threatening than the female model messages. However, note again that this indirect effect was only significant for Republicans, not Democrats. So that again suggests a stronger reactance response from Republicans than Democrats. To summarize, with this study, we sought to contribute to the current efforts of public health communicators to develop effective COVID prevention messages and engaging a question that has frequently been raised in the design of strategic COVID-19 messaging. We examined whether a forceful or a courteous message would produce greater intentions to wear a mask. And we sought to advance reactance scholarship by examining visual message features in addition to language features and looking at whether the two of those interact, as well as by testing psychological reactance theory in the context of promoting behavior meant to protect others rather than oneself. And in terms of the findings, I'll reiterate that this study was conducted earlier on in the pandemic, before mask mandates went into place and before people's behaviors had generally been set in stone. So we found that forceful language and messages featuring a male model generated lower intentions to comply with the mask appeal. And model sex in the message appeared to directly affect intentions, whereas forceful language had an indirect effect via reactance. And these two sets of effects were stronger for Republicans than Democrats. Also, messages featuring Black models generated more anger among Republicans, but it should be noted that this study was conducted in June of 2020 when tensions between political parties amidst a number of significant events as part of the Black Lives Matter movement. The tensions were particularly high, so it's unclear whether those results would repeat today. So in all, these findings suggest that courteous messages may be more effective for promoting mask wearing, especially among Republicans. And it also points to research that might identify ways to mitigate freedom, or I'll say we need research to identify ways to mitigate freedom threat, whether it's other textual message features or visual message features, when the behavior is a mandate and courteous messaging might not be appropriate. We also could use more research testing whether another gesture other than the forceful hand gesture, like what we used in this study, would be effective. So perhaps other nonverbal cues such as facial expressions would be worth testing. And we also need further research to understand the audience reactions to the public health message model characteristics that we saw in this study regarding the impact of race and sex of the person in the poster. We don't take this to mean that that men or Black models should be excluded from public health visuals, but rather that this points to a need for further research to understand these effects. And future studies could also test racial or ethnic concordance or similarity as a moderator of these reactions. So thanks again for watching our talk. And here's a list of the references that you can pause on if you're interested in the works we cited. And lastly, here's my contact information. Please feel free to reach out if you'd like a copy of the paper or if you want to discuss it with us. Thanks a lot, and I hope you're having a great ICA.